Notice of privacy practices for clinics, hospitals, and other care providers affiliated with the Health Partners and Park Nicollet family of care. Your information, your rights, our responsibilities. This notice describes how health information about you may be used and disclosed and how you can get access to this information. Please review it carefully. This notice is effective May 15, 2014. Summary. Our mission is to improve health and well-being in partnership with our patients, members, and communities. We want you to feel supported and informed in your care and coverage. This includes explaining how we use and manage your information and your rights and choices related to that information. Privacy is a complicated subject. We know it can be confusing, especially when different federal and state laws come into play. We honor the trust you place in us by choosing us for your treatment and care. We hope the summary of your rights and choices and our responsibilities for how we use and share your information helps you understand how we follow the law and honor your trust. In this notice, when we use the term your information, we're referring to information that identifies you and relates to your health or condition, your healthcare services, or payment for those services. It includes health information like diagnoses and treatment plans. It also includes demographic information like your name, address, phone number, and date of birth. Your rights as our patient. When it comes to your information and privacy, you have important rights under state and federal law. This section explains those rights. Ask us about them and we'll explain the process, including if you need to put your request in writing. You have the right to get an electronic or paper copy of your information. You can ask to see or get an electronic or paper copy of your information. We'll provide a copy or a summary of your information as quickly as possible. If there are records that we can't share or if we limit access, we'll help you understand why. You have the right to ask us to correct your information. You can ask us to correct your information if you tell us why you think it's incorrect or incomplete. We may say no to your request, but we'll tell you why in writing as quickly as possible. In that case, you can ask us to keep a copy of your disagreement, a written statement you provide to us, with your records. You have the right to ask us to limit what we use or share. You can ask us not to use or share your information. We'll always consider your request, but we may say no if it would affect our ability to provide care or service to you, or if we are unable to make the change in our systems. If you pay the full amount out of pocket for the service or item, you can ask us when you check in not to share the information about that service or item with your health plan. We'll honor your request unless the law requires us to share that information with your health plan. You have the right to request confidential communications. You can ask us to contact you in a specific way, for example, home or office phone, or to send mail to a different address. We'll do our best to meet your needs. You have the right to get a list of who has received your information. You can ask for a list, an accounting of the times we've shared your information with outside organizations or individuals, who we shared it with, and why. We'll include all the times we've shared your information, except for when it is about treatment, payment for your treatment, or healthcare operations, and certain other times when we've released your information, such as if you asked us to share it, and releases we've already told you about. You have the right to get a copy of this notice. You can ask for a paper copy of this notice at any time. We'll provide it right away. This notice is also available on healthpartners.com and parknicollet.com and is posted in all our care locations. You have the right to file a complaint if you feel your privacy rights have been violated. You can complain directly to us if you feel we violated your privacy rights by contacting us using the information at the end of this notice. You can also file a complaint with the U.S. Department of Health and Human Services, Office for Civil Rights. Find contact information at www.hhs.gov/OCR/privacy/HIPAA/complaints. We won't act against you for making a complaint. Your choices. In some situations, you have additional choices about how we use and share your information. If you have a preference in the situations described below, let us know. Tell us what you want us to do, and we will follow your instructions while following the law. You can tell us not to share your information with your family, close friends, or others involved in your care. You can tell us not to include you in our patient directory when you're admitted to one of our hospitals. You can tell us not to contact you to raise money to support our mission. You can tell us not to share your information with others for health research. We can still use your information for our own research as long as we follow the law. We must get your written permission before we use or share your information to market another organization's products or services. Before we use or share your information to market our own products and services, if another organization is paying us to do it, or if products or services are not health related, and before we sell or rent your information to another organization. Our responsibilities. We protect your information because your privacy is important to us and because it's the law. We must follow the responsibilities and privacy practices described in this notice. We must make this notice available to you in our patient care locations and online at healthpartners.com and parknicollet.com. We can change this notice, and the changes will apply to all information we have about you. If we make significant changes, we'll post the new notice at our patient care locations and online. We'll let you know quickly if a breach, an unauthorized use or sharing, occurs that may have the privacy of your information at risk. We won't use or share your information except as covered in this notice, unless you tell us we can in writing. You may change your mind at any time. Let us know in writing if you change your mind. When the law requires us to get your permission in writing before we use or share your information, we'll do so. We will ask you for this permission when you first become a patient and occasionally after that. This allows us to better arrange for your care, payment for your care, and our operations as described below. If you don't want to give us your permission, then we may not be able to bill your health plan for your services and may need to bill you personally. We may also not be able to coordinate your care. How do we typically use and share your information? We do so in the following ways. To treat you, for treatment. We share it with other professionals and organizations that are treating you or managing your care, and to create a safe and more coordinated care experience for you. This includes sharing with organized healthcare arrangements, such as doctors on a hospital's medical staff who work together to care for you. For example, as your primary care physician, we tell a specialty doctor who is treating you what medicines you're taking to avoid dangerous drug interactions. Another example is to remind you of an upcoming appointment with us. Please note that we don't need your permission to share your information in a medical emergency if you can't give us permission due to your condition. Also, the organizations covered by this notice don't need your permission to share your information with each other, as long as it's to care for you or for another permitted purpose. We may also use and share your information to bill for your services for payment. We can use and share your information to bill and get paid by health plans and others for care that you receive. For example, we share information about the services we provided you to your health plan, so it will pay us for those services. Another example is we may contact your health plan to see if service is covered before we provide that care. We may also use and share your information to run our organization for healthcare operations. We use and share your information to improve the quality of your care and experience and to manage our operations. For example, we use limited amounts of your information to help with licensing and accreditation and evaluating quality. Another example is we share limited amounts of your information with business associates, those we partner with to provide services on our behalf but who aren't our employees or affiliates. These partners are required by law to safeguard your information the same way we do. How else do we use or share your information? We're allowed or required to share your information in other ways that relate to public health and legal activities. We have to meet many conditions in the law before we can share your information for these purposes. We will use and share your information to follow the law, to use and share your information if state and federal law requires it. We will use and share your information to help with public health and safety issues. We share your information with public health authorities and other authorized agencies in certain situations, such as to prevent disease, help with product recalls, report adverse reactions to medicine, report suspected abuse, neglect, domestic violence, or crimes in our care locations, to prevent or reduce a serious threat to anyone's health or safety, to help with health system oversight such as audits or investigations, and to comply with special government functions such as military, national security, presidential protective services, and disclosures to correctional facilities. We will use and share your information to respond to organ and tissue donation requests. We will use and share your information to work with coroners, medical examiners, or funeral directors. We will use and share your information to handle workers' compensation claims. We will use and share your information to respond to lawsuits and legal actions. We can use and share your information for certain legal actions or in response to a court or administrative order or other lawful purpose. We can share your information with authorized law enforcement officials. And we will use and share your information with your permission. If we want to use or share your information in a way not covered in this notice, we're required to get your permission first. For more information, questions, or complaints, please talk to us at your place of care. You can also contact us by phone at the Health Partners Integrity and Compliance Hotline at 1-866-444-3493 or the Park Nicollet Hotline at 1-855-246-7647. Are you also a member of Health Partners Health Plan? Get information about our health plan privacy practices and your privacy rights as a member by calling Health Partners Member Services at 952-967-5000, toll free at 1-800-883-2177, or TTY at 952-883-5127. You can also find that information online at healthpartners.com. Our organization. This notice applies to all organizations and providers. Amory Regional Medical Center and Clinics, Capitol View Transitional Care Center, Group Health Plan, Health Partners Central Minnesota Clinics, Health Partners Dental Group and Clinics, including Wall Orthodontics, River Valley Dental Care, and Stenberg Orthodontics, Health Partners Hospice and Palliative Care, Health Partners Insurance Company, Health Partners Medical Group and Clinics, Hudson Hospital and Clinics, Integrated Home Care, Lakeview Hospital, North Suburban Family Physicians, Park Nicollet Clinics, Park Nicollet Healthcare Products, Park Nicollet Institute, including the International Diabetes Center, Park Nicollet Melrose, Park Nicollet Methodist Hospital, Physicians Neck and Back Clinics, Regions Hospital, RHSC, Riverway Clinics, Stillwater Medical Group and Clinics, TRIA Orthopedic Center, Virtuel, Western Wisconsin Emergency Medical Services, Unity Ambulance, Westfields Hospital, with medical staff who provide services at any of the organizations on this list, specialty programs and services provided by any of the organizations on this list, and independent providers or contractors who participate in our hospital's organized healthcare arrangements. This list may change from time to time as our organization changes and grows. We'll update the list in the notice that is posted on healthpartners.com.